So let's go to Jamil Chade, Geneva-based correspondent for Brazilian media. Jamil? Hello, Jamil. Yes.
Yes. Thank you, Tarek. Thank you to all of you. Mr. Ryan, last week we spoke about, you spoke about Brazil and how the situation was still very intense. A week later, we have an even more difficult situation in Brazil. Is the war still to come? How do you see the progression of the case in Brazil? Thank you.
It's difficult to predict, but if we look at this as we look at the different the hemispheres, I mean, 5 of the 10 countries worldwide reporting the highest new number of cases in the past 24 hours are in the Americas. Brazil, USA, Peru, Chile and Mexico. And that covers a vast stretch. The countries, though, reporting the biggest increases are Brazil, Colombia, Chile, Peru, Mexico, Haiti, Argentina, Bolivia. And we're seeing, while the numbers are not exponential in some countries, we are seeing a progressive increase in cases on a daily basis. It's across a range of different countries, and countries are having to work very, very hard to both understand the scale of infection, but also health systems are beginning to come under pressure across the region. We're particularly concerned about places like Haiti because of the inherent weakness in the system. There are other countries in the Americas in which health systems are also weak. There are different responses by different countries in the region. We see very good examples of countries who have an all-of-government, all-of-society, inclusive, scientific-driven approach, and I think we're seeing in other situations an absence and weakness in that. I think we now absolutely need to focus on supporting particularly Central and South America in their response. The DG has said many times, no one is safe until everyone is safe. And many, many weeks ago, the world was extremely concerned about what was going to happen in potentially South Asia or in Africa. And to a certain extent, the situation in those 2 settings is still difficult, but it's stable. Clearly, the situation in many South American countries is far from stable. There's been a rapid increase in cases, and those systems are coming under increasing pressure. And they need our support, they need our solidarity, and the complexities of the population structure, the number of people living in urban settings, the urban poor. There are so many factors that drive and increase the intensity of transmission. But I would certainly characterize that Central and South America in particular have very much become the intense zones of transmission for this virus as we speak. And I don't believe that we have reached the peak in that transmission. And at this point, I cannot predict when we will. But what we do need to do is to show solidarity to the countries of Central and South America. We need to stand with them. We need to provide the support that we can to help them overcome this virus, as we have done collectively for countries in other regions. This is the time to stand together and leave no one behind.